I'm really sorry I can't join you in person today. Nevertheless, I want to extend my heartfelt congratulations to the individuals we are celebrating at this special event, a day that always fills me with immense pride. Because it's that time of year again. Time to induct a new group of superb clinicians into the Duke-NUS Hall of Master Academic Clinicians. Each year since 2021, we have used this occasion to honor our most outstanding clinical faculty across the Sing Health Duke-NUS Academic Medical Center. These individuals are not only compassionate clinicians who have spent their careers dedicated to providing the best care for their patients, but also role models who inspire with their leadership and commitment while charting new paths to achieve clinical excellence, improving the way medicine is practiced within our AMC. In our fourth year since the program was launched, we will be inducting our largest cohort, 10 individuals whose names are very well known across the AMC and who epitomize the spirit of a master academic clinician. They are leaders in their fields and worthy ambassadors of Duke-NUS who have made significant contributions in domains ranging from education and research to patient safety and clinical care improvement. They are valued mentors and teachers who have been instrumental in guiding peers and nurturing students, making our AMC a dynamic and rich place to learn and grow. And they are an inspiration for future generations of MACs. The unwavering commitment of these master academic clinicians to their patients is critical for propelling our AMC to greater heights as they translate ideas into innovations. I'm confident that their footprints will guide generations of clinicians to come so that together we will continue to transform medicine and improve lives.
When I was a young doctor, I wanted to help save as many lives as possible. And I believe that, that would be achieved through improving my clinical skills, ability to make a diagnosis and give good treatment to the patients. But the more I worked, I realized that actually it was very frustrating because there were many issues that we saw in the healthcare system, and these were structural issues. And that really, at the end of the day, it takes a system to save a life. And as a clinician, you can only treat one patient at a time. And I thought that if I could move into research, if I can collect data, I can understand better where are the gaps in our system, and I can design interventions that I'll be able to help improve the system.
Neonatology is a stressful work area, particularly the neonatal intensive care. When a premature baby is in the NICU, there are ups and downs. So that's why the professional fulfillment is quite important when you support the mothers of these babies to meet these challenges. And I think in the early stages of my career, I was not prepared to see the unexpected challenges. Over the years, I was able to have an overview and also started teaching to the junior doctors in neonatology to be prepared.
I always tell, my mentees, don't be discouraged when arrows are shot your way. Always take it as an opportunity to learn and develop yourself. Look at what the role is and say, is it something that is worthwhile to do? Can you do some good come out of this role? And if you believe in it, put effort and pursue it. In healthcare, it's a high-risk kind of profession. And decisions are not taken easily because we are all risk-averse. So remember that when decisions don't go your way, don't give up immediately. Think of another way to approach it and try to persuade those who are making that decision to change their minds. I've actually experienced this many times myself. You feel as though you're coming up against a brick wall, but you persevere, and more often than not, you achieve your aims in the end.
How do I make decisions whether to go left or right, those critical junctions in life? I think We never really know whether we've made the right decision, and I think that can be tough in life because these days there's so many options for young people. It's almost like they feel like they can only go wrong because there are just so many options and so many choices, and the internet showcases all those choices. I've tried wherever possible to use my gut and sort of say, does it feel right? Just like your moral compass, does this feel right? So I try to, whenever it was possible, to take advantage of opportunities. There are probably opportunities that I didn't take advantage of that I don't remember. I always tell people, if you follow your passion, you'll always be happy, you'll always be excited, you'll always find life interesting, and if you're lucky, you might actually do some good as well.
Looking back at my career, sometimes it also amazed me at the varied things that I have gotten involved in. I think don't be too quick to say no to when your boss asks you to do something, because all these could be opportunities that will open up for you. You will never know. Your talents or whatever may be uncovered because of such opportunities. Definitely you'll be additional work, hard work, but from my experience, something will come back and it always pays off. I guess at the end of the day, we have made a difference somewhere, either for patient care or for improvement of our colleagues' life in terms of better processes. So it's a satisfaction of sort.
I think an important thing is always remembering why they wanted to be a doctor in the first place. And if the incentive for wanting to be a doctor is in the right place from the start, where it is about caring for another individual, and considering that the opportunity to train and eventually to become a doctor is a privilege rather than a right, it helps to build up that care for the patient. And along with it comes a sense of compassion, which is something that the patients are going to be able to feel as touching them. With compassion at work, have an understanding of what the issues that the patients are facing. They want to do better to ensure that they're in a better position, either physically or psychologically, than compared to when they first stepped into the room or into the hospital to see you.
What we must not lose sight of is the human side of being the doctor, the compassionate bit, the empathetic bit. This is in relation to the way medicine is practiced nowadays. We have all along focused on clinical, technical skills, but we begin to realize that to be a good doctor, a good healer, somebody who can relate well to the patient, someone who can empathize with the patient, these are things that are not so easily taught through the traditional way of teaching. So that's when the other aspect comes in. So things like communication, teamwork, being empathetic towards your patient. So that's the reason we created some of these training programs. Hopefully, they will help instill some of these values into our junior doctors.
I think for surgeons, training a junior surgeon require a lot of sense of knowing. It's almost like flying a kite, knowing when to pull the string and when to let go of the string. And that is a constant dance between the trainer and the trainee. And that comes with time. And so being able to spend more time with the trainee, I think that's critical to know when to give graduated independence for them to perform so that they can actually flourish in their profession. Over time, as I got better at doing it, and I begin to see also the value in sharing my knowledge and guiding the junior doctors as well as the medical students in the area of surgery. And that really gave me a great satisfaction to know that I'm making an impact not just on the patient but on the generation of doctors to come.
So I think having a mentor in whatever a person wants to pursue in or is going through, I think it's quite important. Without mentors, I think you'll be inventing the wheel all the time and falling down a lot more. Mentors are really somebody you want to be on a personal term and be able to speak with and ask questions and let the person be able to ask you why, which way you want to develop. So I think having a mentor will allow somebody to sort of move on in their career or in their life. Mentors don't know everything, but we know a lot more people who might know a lot more things. And that approach is important for us to open up the world for the person who needs guidance and who needs opportunity.
When I reflect back again on my journey, a lot of it was honestly a lot of hard work with a lot of support from the necessary people. There were sometimes you just felt like giving up because you were just wearing so many hats at one go. But then again, for myself, I just thought someone has to do it. Why not I be the one to try to make the change and see, just try it. And if it happens, things go along, I can get more people to join me on the bandwagon, share the vision, then we can grow. And the reason for that is sustainability. So the idea really of ensuring that this healthy pipeline continues is through ensuring that we have this healthy track of identifying individuals who are keen to pursue this path.
One of the things that I hope to be able to do more is to actually build the next generation and invest in them.
I always see medicine and research as an apprenticeship.
Very often when we teach, we always say that we are trying to pay it forward.
It is not just treating a patient, but helping learners to learn to treat patients. So there's a multiplying effect.
So being learner-centered is important rather than being educator-centered.
A genuine concern for others and to see others grow and develop.
Allow them to ask questions and clarify to them.
Where something goes not right, what is useful that I find is always to offer support without asking.
By being kind, I think people open up to you more, and it also builds trust, which is very important for many things to work.
My own mentors have contributed to the way I practice. I think I owe a lot to them, so I would really like to express my gratitude to all the mentors.